gathering. Thank you for being together with us. My name is Deepak Raj Sapkota. I am associated with Karuna Foundation Nepal, an NGO working for the prevention of childhood disabilities and rehabilitation. I am also serving as the Honorary Consul of the Netherlands here in Nepal. I am fortunate enough to facilitate this auspicious and important meeting this evening together with you, Your Excellencies, senior government officials, Honorary Consuls, Honorary Consul Generals, respected personalities, friends of Kathmandu Institute of Child Health KIOCH and board directors of KIOCH. We are delighted to have you all here in this evening. Your gracious presence has given us a feeling of confidence and optimism. Thank you, Madam Ambika Shrestha, the Honorary Consul General of Spain to Nepal, the Chair of Dwarika, and passionate philanthropist for hosting this beautiful evening.
I have the pleasure to represent my mother, Ambika Shrestha. Sadly, she is in hospital, but she will be out of hospital tomorrow. So she sends her warm greetings, her very, very big welcome to all of you, and she would like to say thank you that all of you are here. I'm going to go straight into, because he did address everybody, Your Excellencies and the consuls and all, so I'm just going to go straight into why and what we're doing here. So our association actually starts with Dr. Bhagwan Koirala, who is a dear family friend and who we have a lot of admiration and respect for what he does do in this country. This is a gentleman who has, I think, dedicated his life to the medical sector of this country, looking after children. And I also know, like some of my staff, particularly one of my staff whose child was born with a hole in his heart. And I think Dr. Koirala saved this child. So he tells me, just like Dr. Bhagwan Koirala's name is Bhagwan, it's God in our Nepali language. So he says, this is Bhagwan for me, because his child was saved. This kid now, I think, is about 18 years old. So the doctors had said he would not survive. So this is Dr. Koirala for you, who's been dedicating his life to save lives here in Nepal, to give better medical treatments to children. And I think he does, look after adults as too, but I think his heart is where the children are. And I think all of us too, right? They are the most vulnerable. So just to introduce you to Dr. Koirala, I'm going to just read this, because some of you know him, some of you don't. And I think it would do justice to know who is this man behind. Definitely, I'm not undermining his team of people that are with him, his board members. But Dr. Koirala obviously has probably taken the initiative, being from the medical line himself. So let me read this. Let me just read it, that I don't miss anything out at all. So Dr. Koirala was born in Palpa, Nepal, completed his schooling from his hometown. He was graduated from the Kharkiv National Medical University in Ukraine in 1989, so that's a long time ago, and finished his post-graduation from the National Institute of the Cardiovascular Diseases in Dhaka. That was in 1994. Dr. Koirala has completed his fellowship in the cardiac surgery at the Bay State Medical Center in Massachusetts, and then later at the Hospital of the Sick Children, University of Toronto, Canada, and that was in 2000. He's known for, actually very important here, pioneering the open heart surgery program in Nepal since 1997. So he was the one who pioneered that. He also led the Nepal's first heart hospital, the Gangalal National Heart Center, and also led the first heart hospital, yes, the Gangalal Hospital, and as the executive director, so there he was executive, and then after that, while he was there, he has performed 10,000 cardiovascular surgeries personally, or have directly supervised these surgeries. He started Poor Patients Relief Program in 2003, which provides free heart care, including surgery to children under 15, the senior citizens above 75, and the needy. Apart from serving as executive director at the two national heart centers, the Gangalan National Heart Center and the Manmohan Cardiothoracic Vascular and the Transplant Center, he is also executive director of the Tribhuvan University Teaching Hospital. Dr. Koirala has also served as an executive vice chair of the Health Profession Education Commission formed by the government of Nepal to draft an HPE bill. He has also served as a member of Policy Advisory Committee of the Ministry of Health of Nepal and facilitated the inclusion of non-communicable diseases as a policy agenda in the national health policy. He has been awarded with the highest civilian honor for his excellent service and for the outstanding contribution in the country. He has been awarded with the Subar Gorkha Dakshin Bau, Birendra Aishwarya Medal for Outstanding Services in 2001, Subral Jana Shewasri 3 from the Government of Nepal in 2012. He is a member of the Society of Thoracic Surgeons, European Association of Cardiothoracic Surgeons, and a fellow of the American College of Cardiology. Dr. Koirala is credited not only for pioneering the open heart surgery in Nepal, but also for giving hopes to the poor people from child to the elderly with subsidized cardiothoracic surgical treatment. He believes, and this is important, no child of this country shall die of heart diseases just because of poverty. Currently, he holds the position of head of Department of the Cardiothoracic and Vascular Surgery at the Institute of Medicine, Tribhuvan University, Kathmandu, and also serves as a national co-chair of the Nepal NCDI Poverty Commission. So this is Dr. Koirala for you. So we see that he's a professional, he's a die-hard service giver to the community, to the elderly and the children, the most vulnerable sectors of our society. So today I'm here representing my mother, and I'm just going to share with you how do we come to be here. With this background of Dr. Bhagwan Koirala, obviously this trust, this confidence that when he begins something, he's going to bring it to the end, to a fulfillment. But obviously he's not going to be able to do this on his own. These are huge projects. Dr. Koirala himself will present the projects to you. There are going to be 7 hospitals, so I'm not going to go into this. Dr. Koirala will present it. I'm just going to share with you how we've come into it. It's because, of course, our relationship to Dr. Koirala, but the Dwarikas group has always been that we want to add value, we want to make a difference, so wherever we can. So what we've done is that we're saying, okay, what do we have? We're a hotel. So we have food and beverage. I have rooms. I have staff, I have spaces. So we said, okay, how do we get active here? Let's get active by using what we have. So our premises, we have F&B facilities, so we can offer that. Then the other thing what the Dwarikas has is, I think, a very big network of people. We also have, we're blessed that we have a lot of high-end clientele that stays with us. We also have celebrities, we have government officials. So we are a hub where we can basically bring this information message forward to people that would like to maybe help. How I personally see this is not about the opportunity for the hospital or for the children. I personally see it's an opportunity for us. It's an opportunity for the Dwarikas to be able to be a part of something so great, a part of something that will make a difference to thousands and thousands of children of this country. So I think we're blessed that we may do this. And I'm hoping that all of you, in whichever fields you are, whichever networks that you have, with whichever services you have, you might be able to join. So it's not about giving a donation of a check. It's not about saying that we just talk about fundraising. It's about even connections, networking, bringing people together, bringing the word across. We have all the ambassadors, we have the consuls here. So in your countries, maybe there are similar organizations, you can maybe connect them. I don't know, there are many ways in which you or your country could be a part of this. it always doesn't mean you need to give a check. So I would like to sincerely make a plea to say, please, do get involved on a personal level or in the capacities of the offices you hold or carry. And not all just understand that we've invited you here to raise money. We didn't. We're here today to just make you aware something like this is happening in Nepal with a local initiative. These are local people starting the initiative. So let's, that you just join hands. If nothing, at least if you give them exposure. So I think we're going to leave it to you all to decide. How would you like to participate? How can you add value? How could you bring an extra step to this project, which is so noble and so worthy? So this is what I have to say. And again, for my mother, the warmest wishes and a big thank you from her too, that you're all here. And I'm sure we'll be doing some more programs like this where you will get to see her standing here instead of me. So once again, thank you all of you for being here. It's such an honor for Dwarikas to be a part of this endeavor to look after the children of this country. Because we can't do it. How do we do this? But there's somebody doing it, so if we can help him, it's as good as we're doing it too, right? So that opportunity is something I'm putting in front of you, so please do get involved. Thank you so much.
I think my job is done, and I think half of the job of Dr. Koirala also is done. Well, thank you very much for this wonderful introduction. Now I would like to invite Dr. Bhagawan Koirala, who is the chair of KIOCH, Kathmandu Institute of Child Health, a very well-known cardiac surgeon, a greatly celebrated health institutions manager, and a visionary person, to share with all of us about KIOCH movement. I would like to say it movement because it's not one project. It doesn't end at some point. It continues. It's a movement. What has been achieved so far? It's not a very raw new idea. There are so many things to tell. And how we all can bring this movement as a solution to the child health in Nepal. Being here together with you all, I could not resist myself to share that I'm one of the founder members of KIOCH, and this is my connection of being here. Before I give the floor to Dr. Koirala, I would like to invite board directors of KIOCH for introduction. Bhuvan Dahal sir, Varsha ma'am, Mr. Satish Moore, Dr. Ramesh Adhikari, Dr. Jyotindra sir. There are 7 members in the board, and out of 7, 6 are here. One, Mr. Govinda Adhikari, is sick, is at home. So this is board that is carrying on the responsibility.
Thank you. Good afternoon, Excellencies, representatives from embassies, from representing different countries in form of honorary consuls, and my friends, my senior friend Dr. Bindu Dhoni and others. It's truly humbling, very awkward when Sangeeta went on giving introduction, and I almost forgot what was done 20 years ago, for example. But it's truly humbling and very pleasing moment that you all are here. And many of us have met before, worked on the project, worked on the concept before, but many of you are new to this. I'll go straight to presenting what we're trying to do, and please take it from me that it's not that we're trying to give a solo solution to the big child health problem in the country. The Nepal government, along with many of you or your countries, have done tremendous job in the past in reducing the maternal and childhood mortality in the country. But it seems not enough, and we'll share some of the data. And I think many of us are here, including my board, and thank you for being here, all passionate because we've been through the pain of losing others' children, knowing that we could have saved had we had some of the facilities that we think are appropriate and necessary to do. And So it's not just a theoretical trying to do good to the society, but also comes from deep the depth of our hearts that this is something that we're compelled to do. As Sangeeta said, I think there is something that we can do to this in this area. As I said before, this is my, our team, great people that I have a chance to work with, my seniors, professors, and I also need to introduce two of our great technical team leads, team people, Dr. Sabina and Dr. Sudha, professors, who've been such a guiding force in modeling the quality of the institute that we're thinking. You may want to either raise hand or just stand up so that everybody recognizes you, Sabina and Sudha. And of course, there are others. We had to give some form to the concept. So we started with the name Kathmandu Institute of Child. A lot of people even question why Kathmandu, why not Nepal and stuff. But I think what is in the name. But the idea is to try to come up with a solution for a big problem, and this becomes part of our commitment to the societal needs. I don't have to say much about this, many of you know, but just to give you a recap of why this is important. Nepal, interestingly, has 3/4 of the deaths in Nepal are due to some sort of non-communicable disease today. Not that the communicable diseases have gone away, we still have a lot of problems. But 71% of all deaths are due to some sort of NCD, and 8% more are from some sort of trauma, injury, violence, suicide, and whatnot. So this is overwhelmingly big. And many deaths among the children could be avoided. That's why we suffer, we as doctors suffer. And I've seen, when I've done thousands and thousands of children's heart operations, apart from the adults, as he said. But we've seen, the outcomes far inferior than the West, where we were trained at some point, because we didn't have a comprehensive care setup. So we feel that from inside. And investing in child health has probably higher yield in social or financial form or whatever you like, and highest impact on the public health indicators that we say is DALYs or YLLs, years of life lost. And unfortunately, the disparities in outcomes are there based on gender, ethnicity, and the geographic locations of the children where they live. So it's unfortunate that happens. Now the problem is we have 4,000 plus public health facilities, small, mid-size, and big, but there's only one dedicated children's hospital in Kathmandu in public sector. There are some in private. It's clearly not enough for 12 million children that live in this country. Well, just to give you a glimpse of what goes on around the globe, I mean, its situation is not better, of course. Nepal may be slightly better than many of the African countries, but it's a very problematic scenario if you look at it. I don't want to get into the detail of the numbers, but the point is that too many children die, even if they were potentially curable or treatable. Look at Nepal's numbers. We have still very high than what expected or acceptable number of deaths among the neonates, meaning before 28 days of life, before 1 year of life, and almost 3.5% of all born children actually die before the age of 5. Look at this. We have never had a chance to look at those details now. More than 2%, well over 2% of all birds have some sort of birth defects, meaning they need some sort of care here. It's not just about preventing. And there is stunting, there is anemia and other problems, as we know it all. Now, there is an SDG that we all have committed to. You all have been part of the struggle in trying to reduce the target, reduce the deaths and meet the targets. If you look at it, I'm not sure you can see the horizontal line here. That should be the Sustainable Development Goal target by 2030, and we in South Asia are way behind that target. And unless we look at the problem differently, I think the conventional way of trying to reduce this has not worked. And for the last 10 years, Nepal's neonatal death hasn't changed. It's remained at 21 per 1,000 born children. Now, it's easier said than done. Solution certainly is not to change completely the strategy, but to build on the current efforts, of course. Improve the immunization coverage. We still have, a huge number of children out of the immunization scheme, WAS programs and nutrition programs and community-based treatment of infectious disease. All that is good and we need to build on, but looks like now it's not enough. Many children are premature, have congenital defects, birth defects, other diseases, hypertension even now, NCDs. So they need to have a chance to be treated. I think that's where the focus wasn't here so far. I think that's what we're trying to kind of highlight. It's not necessarily all specialized. What we say is specialized tertiary care at the center, have a strengthened secondary care, which is be able to treat children's problem at the district or provincial level. Now this is KIOCH thing. That's what we all think, at least we are contemplating on doing, is Kathmandu Institute of Child Health is a concept that wants to have a hub in Kathmandu. Hub is important because we can't back up the peripheries without having a hub. And then have one satellite hospital in each province. Small, maybe 50, 100 beds, having a community outreach programs, some research component, and then have in each province. We're a non-profit initiative. We all worked at some government institutions at some point in time. And by the way, Sangeeta, I just retired from the university. I no more am the head of department, but I was running a lot of these public institutes, as you said. But all of us are committed to the public institutes. But I think at this stage, we want to do it as a complementary to the government institutions and a non-profit model. That way we can partner and collaborate. By the way, we have a formal agreement and partnership agreement with the Ministry of Health, so that we will do it together. They will support in policy interventions, and we'll try to raise funds. And they also put some money in this year also with some funds from the government. So that's the model. It's a little big for the nature of the institution that we're talking about, but if we all come together, it's really not a big project. It's just the way we look at the problem. I think this is the way we see how to solve. In Kathmandu, right now we're moving steadily, slowly but steadily. We have a research building completed. We have a Pen Plus project. It is a Harvard University partnered project to have the district hospitals in taking care of the NCDs in young adults and children. So this is also very important to work with the government institutions. The big hospital complex is a little lagging behind there. It's under construction now. We're putting the foundation here. That's the timeline that we think. It's a big project, we know. We have a 10 years plan, almost 10 years plan. If you really started, consider the start of the project in 2020, where we got the land from the government. It's a government land. We look at a 10-year span. We've spent already 3 years now. But in this period, we spent the time well, despite the fact that there was COVID pandemic, there was an international financial crisis, all sorts of other, classes and violence. I think the progress is not too bad. In the meantime, we've already completed one satellite hospital in eastern part of Nepal as part of our concept. It's a provincial hospital, now 50 bed, but always occupied to 70 or 65, and 250 to 300 children attending this hospital every day now. We just completed 1 year, and this 1 year has given us a lot of insight into how to do it better, and is it necessary, and what are the lessons that we learned. This is some of the glimpse of the hospital from there. This neonatal ICU, total of 18 beds critical care, 10 beds in emergency, and other 60 beds now. First year data from the satellite hospital actually gives us a lot of insight into why was this important. Now we believe that it's the right thing to do. We've already seen 50,000 children and outpatients and inpatients there in 1 year. Where were they going before? Probably somewhere to adult doctors and somewhere else. Probably getting treated somehow or other for sure. But people like to come here from 8 different districts here. So you can see the pie chart, of course, from the Napa district where the hospital is located, but there are other feeding districts because there are no dedicated children's hospitals and the specialized care there, so people come. In fact, we see almost 2 to 3 times more than what BP Koirala Institute, which is biggest 1,000-bed hospital in the East, sees. So it's already a very important milestone there. And next thing is, it's not that we want to show it ourselves, it's a partnering with the government institutions at the provincial level, district level, that we already started to work, and hopefully we'll have a central level partnership with Central Children's Hospital, County Children's, in some of the very niche area of specialties, mental health, cardiovascular, cancer care, which our Central Children's Hospital has not yet been able to develop the way it should have. So I think there should be complementarity. Now, of course, we believe in this, so we'll defend the model, but I think there is more to that. Why? Not just KIOCH. Institutions like this, non-profit, dedicated team, it's agreement with the government, it's performance-based payment that is possible. This model has been exercised in the country with eye hospital, for example, and I think this gives us a flexibility of having a right model of governance, professional management, stability in leadership for 5, 10, 15 years. We know our public institutes grapple with the changing leadership and a lot of political interventions a lot of time. And well, I shouldn't be saying this, but I think we have a right team, very credible board of directors, a lot of senior to me, and I have a great deal of respect and trust in my seniors that are with us. And I think most important thing is this model probably relieves the government of long-term liability of human resources. That the Ministry of Finance struggles so much. I mean, we are building hundreds of level 1 hospitals now in the Palikas. Government is doing it. But there's no way that Minister of Finance would approve the slots, what they call darwandis, to fill the positions. Now, how do we run it? So I think this would be a good alternative of not having long-term liability of HR, but just pay for performance, quality, and yet have an institution that doesn't make money. It provides service at the rates of government. We get reimbursed from Kosi province in that provincial hospital, children's hospital, as part of the insurance, national insurance, health insurance rates. So I think it's a good model and a way of avoiding the long-term liability for the government. I think there's a lot to be said about it, learned about it, and shared about it. And you know, it's not a complete solution, but we want to work not just at the hospital level, but also do research, and we're already starting that now, even if we're not a complete hospital, and doing public health work that we're already doing at the district hospitals. So that's our dream, to be kind of comprehensive in thinking, how can we reduce the suffering of children, not just by treating them, but also by educating them and helping the peripheral institutions in getting that. I must say this, as Samita said, we're not here to, solicit or say something, but just to give you a glimpse of what challenges, this project has. This is the funding situation for Kathmandu. Despite the crisis here and outside, I take it very positively that we've been able to generate a lot of support from within Nepal. And thank many of you already been part of this. And I really am, I'm humbled by this experience. We expected kind of reverse thing. International would be more and national would be less. But I think it's great. This yellow thing is funding gap. The gray is kind of asking some positive gestures, but not there yet. So I think we've got some space to go in Kathmandu. But then decentralizing to satellites is next level that we're looking at. We already have a kind of prototype. But again, we're looking at CSR partnership, partnership with the Nepal government, which we already have in place, although money doesn't come as easily as we would like to. A lot of individuals, we have taken initiative. I mean, I'm so humble and become emotional a lot of times. People keep calling, oh, you got this project, we like it, it's important, can I help? And it's amazing to see. I didn't expect the office would be so forthcoming in this regard. So I think it's a positive vibe here. And of course, we look for international foundations. We're already working with some, and some of these foundation reps are here. Here it's not a huge amount, as I said, but I think, and of course, we are looking at creating a model where bilateral partnerships, as in bilateral agencies, would be somehow getting connected. So I think all of these are the ways that we're looking at having partners. Now, what will all this give to the children of Nepal? This is very arbitrary and ad hoc calculations based on the 1-year experience from the Damok Children's Hospital in Satellite Hospital. This is just 50 beds. We could easily increase to 100. There is a demand now to increase to 100 plus beds there. So if we do 100 beds everywhere, maybe it will double the number, but 400,000 children's visit per year if we complete 7, and of which at least 200,000 will be new cases. So new means they really needed something, it's not just follow. And of that, probably 40,000 would have been admitted as a sick kid and gotten better. Of course, there will be some losses probably along the line. This is a big number, but again, this can go double if we increase the size of the institutions. It's just calculated based on 50 beds, 250 children per day for 300 days. And of course, if we do research, education, and networking at the community level, we would probably be able to touch millions of children's lives over the next, foreseeable future. This is per year. So if we keep working for a long time, I'm sure this will be able to leave a dent in child health. So this is me. I don't need to even read this slide out. Sangeeta said it all. But fellowship, training, capacity building is so important. I mean, I see this more important than having money. Having people trained, committed, staying back in Nepal, going out to the periphery provinces would be even harder to do and more important to get. So we need your endorsement on this agenda. I know you are all here because you support this cause. So this is from the children of Nepal. And we want to make children's healthcare available, well, not anywhere, most of the places in Nepal, anytime, affordable, and have a decent quality. Thank you.
Because I would like to come back to you. Yes, the presentation is just done. Information is fresh. If any of you would like to comment something, ask something, give compliment something, or whatever, let's do that first, and then we have 2 more speakers, and then we'll have more information.
I was just wondering if you could elaborate a little bit on your public health approaches and the research agenda that you're thinking about. Thanks.
Thank you. We're actually, even before our hospital started, we started working with the government, and here, I had personal connections. I also work on public health. Our team also does with the government. Sudha is a lead in vaccination trials here in Nepal. So many of us, he himself, Ramesh Kant, the professor, is a great researcher. In the past, he's been Dean of Institute of Medicine. So we do that, as our professional career. But through KIOCH, we're working with the district hospitals of Nepal. Right now, we have taken 7 district hospitals, together with Harvard University's collaboration, on educating the doctors, paramedics, as well as the specialists there to take care of 10 major NCDs that kill most people in Nepal. We call it PEN Plus project. PEN project is owned by Nepal government. It's very basic treatment of hypertension and the diabetes, COPD. But at the district hospital, that's not enough now. So that's something that we're working with them, getting the data, how that works, looking at the outcomes, looking at the adherence of these treatment modalities. We train them, we give technology, not we, basically our partners to provide with the implementing partner, give technology, give some HR, and provide those services from district hospitals. We also do some research ourselves. Particularly, we looked at national burden of disease among, non-communicable disease burden among children. Not community-based. Right now, we're actually on the PI doing one cardiovascular prevalence at a national level, but this one is all NCDs, major NCDs, across 15 institutions that provide pediatric care. That has been published together with the Nepal Health Research Council. There are some other publications that we did from NCDI Poverty Commission that we said. So I think these are the initiatives that we're taking now, apart from the individuals that are doing research on his or her own capacity through different institutions. So KIOCH as an institution is part of this few things. And now we have 2 more, I forgot to say. Mental health is a big time problem, and we're the implementing partner secretariat for ROSA, South Asia Office for UNICEF, for mental health in children. And there are mental health guys, I don't do that, but I think we're trying to be there together with South Asian countries in trying to develop some resources, develop protocols. Our team does that. And what else?
Development, child development.
Right, and then please, I mean, if there's something else, yeah.
You can just-
And we're also focusing on this UNICEF-supported 4 districts where that Pen Plus thing will also look at the neurodevelopmental issues of children, detect this autism and other issues early on, refer early, and have some counseling services. So I think we're in very early stage, but that's the kind of direction that we're taking. Hopefully we can build on this. This year we can scale up to another 6 districts. So hopefully we'll go to 15, 13, 14, 15 districts. Maybe more research to come. And we just started very primitive, we're in infancy, concept of Research Innovation Center of Excellence within Institute of Childhood. So we're already trying to have a tradition of having innovation within an institute, even before we had the hospital running. So we're trying to implement some of the quality indicators at the KIOCH provincial hospital. So a few things that we're trying to do, we're refining ourselves.
Healthcare workers, doctors, nurses. As you know, we have the exodus of all nurses going abroad. Problems like that, brain drain. So for your specialized hospitals.
Wow, that's a great question.
This is the main, I think, the hurdle maybe you will face, but I know that you will probably craft that situation.
No, that's a great question.
How to man these hospitals, with dedicated workers for the children. So.
No, that's a great question from 2 points, from 2 aspects. One is having doctors trained in pediatric specialties, nurses trained and paramedic, because children cannot be taken care of just as the adults are. They are not small adults. That's how we say it. Children are not small adults. I mean, we don't divide by 4 and give prescriptions. There is a different mindset, different skill sets. Even I do a lot of pediatric. I was trained in pediatric cardiac surgery, but I struggle when it comes down to taking care of a child in general. So it's a skill set. So there is a need in training them. That's what I said in my presentation. And secondly, even those who are trained are leaving now. How do we retain? Fortunately, good news, from the satellite hospital, 1 or 2 people left for purely family reasons, not outside of the country yet, although it's only 1 year that we've been running. But the rate of exodus of nurses from the central Kathmandu hospitals every month, dozens leave. So I think people go there because they have some other connections, and we treat them well. I think these are the reasons that they are not leaving us yet, but that problem exists nationwide. That's exactly why we think having a hub in Kathmandu is important, so that we have a group of reserve who can compensate if there is not enough people going out to the provinces. We know sending people, pediatricians, to Karnali is going to be hard, and they're not going to stay there for long. So we need to have that kind of revolving fund. That's why we're kind of sticking to the Kathmandu thing. Everybody else says, why yet another hospital in Kathmandu? Why do you need it? But I think that's the reason we're advocating for having one in Kathmandu and supporting outside hospitals. Thank you.
Not concerns, on the contrary. And not compliment, but compliment. No, thank you very much. It's fantastic. I mean, I was here, of course, 12 years ago with UNICEF, and having worked extensively in Karnali at that time and walking a lot, I think at that time the health system depended so much on the community health volunteers. So to come back years later and to find there is a center of excellence with this capacity, I think is extremely rewarding, because extremely rewarding, but also it's brilliant, the idea of a revolving, because I think the concept of the brain drain and of health workers is a very worrying issue. But having something like this that will attract and make them stay, but at the same time ensure that there is good capacity for the remote areas, I think is very critical. And of course, for some of us who have been walking in the Karnalis and the difficult areas in Nepal, know that child health is so vulnerable, and it's really simple things that can make a big difference in the lives of children. So it's just a word of appreciation, and I'm glad that you continued the partnership with UNICEF Rosa on that. So hopefully, I'm sure WHO and UNICEF here also will continue their support. Thank you.
Any other whatever? Comments, compliments, supplement, recommendation, even little bit challenge, provoking statements? If not, thank you for your wonderful remarks. We have three. They are not a speaker. There is the words of encouragement and solidarity. I would like to invite Mr. Arno Suat, the country director of ADB, to express his words of solidarity.
Okay, thank you so much. I haven't prepared anything. I was not really going to speak, but I gladly accepted because I think really what Bhagawan is trying to do here is totally exemplary. Actually, we got in touch together through a common friend called Dwarika, who is also known as being the happiest man in the world. I don't know if it's true. And so he put me in touch with Bhagawan and said, Arno, since you're working into development, look, Bhagawan is really struggling, trying to create something unique here. Can't you help him? And I say, well, yes, okay. And then somehow, I'm not involved, ADB is not doing health, and he's very busy and very busy. And, things happen, we lost track of each other. And one day, I'm in a plane, coming back from Sudopashin, and someone is sitting beside me on the plane. And that's Bhagawan. And it took us about 10 minutes to understand who he was and who I was. And then started a very interesting discussion where, I really was stunned by what Bhagawan was trying to do. And I felt, okay, ADB is not doing health, but my role here is also to try to support whatever. And when I see people like that, gems who are trying really to promote unique things for Nepal with such passion, I thought we have to try to do something. So eventually we had a follow-up meeting with my dear friend Faris, who's the World Bank who's the country director of the World Bank, as you all know, and we started discussing more into details about this project and what we could do. And one idea was actually to try to convey all friends, ambassadors, and head of cooperation to listen to Bhagawan. And I'm very glad to see that, well, it has happened without me having much to do with that, I have to admit. But I was very happy to be here. So all this to say that I think what Bhagawan is doing here is a concern for all of us, and even me in my quality of country director of ADB, I think it's a duty to try to support in any way. There are few homegrown initiatives such as this initiative in Nepal, led by people with the quality and caliber of Bhagawan and of course his board. And I hope that we can all collectively support this endeavor, because it's not an easy one. He's not sharing things, but I can tell you he's going through a lot of problems, and he has to put his neck all the time on the line. So with this, I just congratulate Dwarika for this, and I hope that this meeting will be successful. Thank you.
Yes, the world is having lots of problems, and it's really a difficult time. Corona, the wars, and blah blah. But despite of that, the Nepalese society, the corporate sector of Nepal, though it's not that big, is generous enough, and we have been able to raise almost like Peace Corps is 300 million $30 million. Almost like $30 million US in last 3 years within this country. So it's, I think, pretty big size of money that has been collected for this kind of work.
Satellite and Kathmandu together, we raised within Nepal and probably little outside $5 million.
Yes. So this is challenging, but things are moving too.
With your support.
Now, long-time friend of KIOCH, I would like to invite Her Excellency Miss Felicity Volk, the Australian ambassador here in Nepal, to help. To bring this discussion to the next level. Everybody knows that, like, wherever she goes, there is energy,
Well, that's a challenge. I'm bringing energy. Similar to my friend and colleague from the ADB, I did not come here with a plan to speak, and I have no notes, but I am very honoured to be invited by Dr. Bhagwan to just say a few words also of encouragement, endorsement and commendation for the work that's been done already. And I do thank Dwarika's Ambika in absentia Sangeeta for hosting this fantastic event so that we can all come together around such an important project. I arrived here 3.5 years ago, and one of my staff had a son who was going through a very difficult time with a heart condition, and in fact he was one of Dr. Bhagwan's patients. So I had a very, very early understanding of Dr. Bhagwan and the importance of his work here through that direct connection in my embassy. And then a few months later we met through mutual friends, and I was struck by the humility of this extremely talented and committed person. And when I was listening to Sangeeta's comments about all of his achievements, the one thing that I thought also needed to be mentioned is the extreme humility of someone who is such a national treasure here in Nepal. And so when we met to talk about this project, KIOCH, a few months later, while I didn't have a lot of funding available, but just a small grant through our direct aid program, I just felt that it was so important to provide just some seed money. It wasn't money that, it was so small it was not enough to achieve a lot in terms of the magnitude of this project, but the importance, I think, of showing support at an early stage and saying, yes, I believe in this, yes, we believe in this, is absolutely crucial. And so I would encourage anyone who can to consider even small amounts of support, but also that diplomatic and moral support that is so important. For me, it's a very personal, it appeals to me in a very personal way. My youngest daughter was born with not a life-threatening condition, but a condition that required a lot of medical treatment over about 6 years. I was in Canberra with her, our nation's capital, a city that only has around 500,000, 600,000 people, and therefore the medical services that are available in Canberra reflect the size of the local population. And so all of the treatment that my daughter Poppy had to be conducted in Sydney, 300 kilometres away. So for about 6 years of Poppy's life, we were doing a trip to and from, driving up to Sydney, often once a week, sometimes once every few months. So I feel very keenly and understand very keenly the difficulty of accessing appropriate health services. Even in a country like Australia, this represents a challenge. And so when I first got involved in KIOCH through our embassy's direct aid program, I had that direct personal sense of connection with the vision of Dr. Bhagwan. But now 3 years later, having travelled the length and breadth of Nepal, I'm even more keenly alert to the importance of this project, because I have seen how modest health services are in the most remote parts of the country, and people travelling, walking for days to access even basic services. And so I want to applaud the vision. I want to say that Australia whether through financial support, but more through moral support. We remain a partner for you. I applaud the board. I've had the chance to meet some of you at different events. I know the level of passion and commitment that you all bring to this vision. I will be leaving in a few months' time, but I will be coming back regularly to Nepal. I so look forward to watching this grow, this child of KIOCH grow into an adult KIOCH. I know it will be successful, and I think one of the areas that I'm interested in hearing perhaps from you in the broader floor discussion is opportunities to make connections in the international space, not because countries like Australia have a lot to offer, but because we have a lot to learn. And to create those exchanges, whether it's in research or in exchanges for several months, both with specialists, with doctors, with nurses. This morning I had the chance to have 15 nurses from the University of Tasmania who are about to graduate, to have them at the embassy. They're here on a 3-week placement. They've done 2 camps in remote parts of the country. They spoke of how much they learned from being in Nepal, from seeing the delivery of health services in remote locations. This is something I would like to see more of. Australia has so much to learn from Nepal, as well as sharing whatever we can to support your vision. So thank you.
Thank you, Your Excellency, for your wonderful words and solidarity and support and working together with us. Now I would like to call upon His Excellency Ralph Fenn, the British Ambassador, for his words of encouragement. And then we have Dr.
Well, unlike my 2 predecessors, I was warned that I was speaking tonight. So I have some remarks in 2 halves. The first half is all factual and prepared by my team, and the second half is on the back of this envelope, prepared by me. But nor can I actually cap Felicity's very personal anecdote about her lovely daughter. I can only say personally, I do have very recent experience of how patchy medical provision is in Nepal. I just completed, underlined completed, the Langtang trek, had the celebratory dinner with Sherpas and porters, and was then struck down by a kidney stone. I was in terrible pain. I was not offered a doctor, I was offered a shaman. This was in Shafrumbesi. I accepted. I was in such pain, I thought that was a brilliant idea, but my wife pushed me onto a helicopter and I came back to Siwak, and I had fantastic treatment here in Kathmandu, so big thanks to them. The factual remarks by my very expert colleagues in our health team in the embassy are divided into positives and challenges. So the positives are very significant, and I think it's important to dwell on those a little before we address all the other stuff that does need to be done. I mean, in the past 2 decades, Nepal has made incredible progress in improving the health of children. Since 1996, Nepal has witnessed a 4-fold decrease in child mortality rates, and neonatal mortality has more than halved during the same period. Nepal was declared polio-free in 2010, and immunization coverage overall greatly improved, with 80% of children fully vaccinated in 2022, compared to just over 40% in 1996. Child nutrition also improved dramatically, with stunting decreasing from 57% to 25% between 1996 and 2022. Wasting also decreased from 15% to 8% during the same period. Child health generally is a priority agenda across key Nepal stakeholders, and I do pay tribute to Nepali civil society for prioritizing health, for talking about health. Everywhere we go, we meet dedicated people trying to make things better. But the challenges are immense. Still over 4% of children receive no vaccination. and those are mostly within marginalised and underserved communities. And we all know how hard that last yard is when it comes to public health. On the wasting front, the situation is relatively stagnant, pointing to systemic nutritional issues, and stunting still affects a quarter of children. There are decreasing trends in exclusive breastfeeding. I think I know what that means. I hope these experts do. Persistent issues in the quality of care and the inequitable access to health services for certain populations and geographies, particularly in the Terai and in Karnali. So it's that mixed picture. Nepal is in many senses, and I know with the UN resident coordinator here, I must invoke the Sustainable Development Goals. I think Nepal is in many ways a model member of the United Nations. It has great policies. But actually implementing those policies and getting into the households and helping the kids is still a huge struggle. So turning to my improvisation, I will not tell you about Dr. Das because at least 2 people in this room have heard me say it about 3 times. But when we were celebrating the 100 years of friendship between the UK and Nepal at the end of last year, I did have a very inspirational encounter with a gentleman who was himself 100 years young, and he had travelled to the UK to get his medical training at a time when, for those of you who know your history, you will know how long ago this was. He couldn't fly out of the valley, he had to get a boat from Calcutta and get there by road. He got then to the UK within about a fortnight, but on the way back he bumped into something called the Suez Canal crisis, and he had to go all the way around Africa, and it took him 40 days to get back to Nepal. So, I mean, I tell you that just as a kind of sense of how long the UK has been involved with Nepal's health sector, and we're very proud of that. The next 100 years is the key thing for us, and we had our Minister for Development here, Andrew Mitchell, a month ago, and he helped us launch our refreshed portfolio of development assistance. It's worth £400 million through to 2030. And health is a big part of that. I'll try to unpack that because how do Nepal's development partners help on health? It takes many different forms. We need to find where the individual partner can make most difference. And in the UK, we are getting out of building hospitals. I have to say, we're still trying to retrofit 2 hospitals against earthquake damage. I think it's in Pokhara and in Bhaktapur, and it has been a nightmare to get those 2 projects over the line. And we do feel that we are doing more good for more people by getting into what we call system strengthening. We have we brigaded some of that work, so both in health, education, WASH, hygiene, and also in infrastructure. Under this heading of system strengthening, it's in a program we call Samartha, and it is still sort of stuck in the Ministry of Finance. So any of you who know the Ministry of Finance and you want to help the British Embassy in its mission, please lobby for Samartha to be approved. Ideally so my boss can sign it in the margins of the investment summit, but I'm not holding my breath. But really, we are patient, and we will get this over the line. We believe very much in continuing to work in the health sector. It's vital. That's why we're all here tonight. Data-driven health. I mean, I think it was great to hear our chief guest here talk about data sprinkled through his presentation. This is clearly a data-driven initiative. That's something that the UK applauds. My own first field visit was to Lumbini. We tried to make sure that all of our programs land in at least 3 of our 3 priority provinces. So that's Madhesh, Lumbini, and Karnali. Down in Lumbini, I visited the hospital, and we talked to the provincial health ministry, and they are data-driven. The good news was that they knew that maternal health was their top problem. The bad news was that I also visited the site of the birth of Lord Buddha and learned that his mother had died within days of his birth. And so in exactly that same place, maternal mortality has been afflicting Nepalis ever since Buddha was born. So that's quite chastening. There is a lot still to do. Moving from what we do as a government to what we do as a people, health has also been a key part of the people-to-people links between the UK and Nepal, which I regard as even more important than our development assistance. It is what drives the development assistance. It's what makes it a no-brainer for British ministers to say, yes, development assistance to Nepal is absolutely what we should be doing. That's because the British people are pretty much infatuated with Nepal, and they come here and they get stuck into helping, often in a rather chaotic way. I have to say my life is heavily kind of influenced by all the different civil society organisations in the UK which want to do something with Nepal but haven't quite decided what, and fall over each other and need to be helped to add up to more than the sum of their parts. But there are some key kind of organisational structures which I cling to. I think the professional relationship between professionals in Nepal and professionals in the UK is a huge part of the answer. And some of that is really ancient in its connection. We've had the Royal Colleges of various sorts from Edinburgh, Glasgow, London come and enroll, and literally means writing into parchment the names of those who have graduated from this training program in the UK. I love those kinds of professional links. On the chaotic side, I would just name check a few things which kind of happened to me, but do illustrate my point that health is kind of front and centre in our bilateral relationship. There's a lovely couple called Wendy and Robin Masterson who came and got terribly moved by burn victims in Nepal. And their work around burn survivors in Nepal, I think, is a perfect example of what individuals can do, and this is now in the hands of highly motivated young Nepali people who are carrying that work forward. I met an ophthalmic surgeon who had come on holiday and then started to come back to Nepal and do operations and then built a hospital. Unfortunately, his hospital has been effectively stolen from him by a local gangster. It is really difficult to keep these grassroots initiatives going. There was a brilliant evening I spent with British enthusiasts for the field of disaster medicine. Not something I knew anything about, but obviously if you think about it, in the first minutes after a major earthquake, the first responders are not doctors and nurses, they are individuals who are on the spot. And this whole now global field of spreading good sort of first aid and the right medical instincts among the first responders and the sort of blue light brigade in every country is a very key way to save lives. Last night I was at a wedding, and I was lobbied by somebody who has a factory in India and is talking to the National Health Service in the UK and thinks he can reduce some of the pharmaceutical costs by 75%. Brilliant. We will follow that up. Who knows? I'm sure all of you know Dr. Buddha, who approached me very early on in my time here and told me the story about research connections. His own contacts with someone in the UK based in Oxford who was in the middle of COVID, right? This was when we had no therapies. We did not know what treatment would make most impact. This British doctor and academician decided to try and encourage his international contacts to begin data collection around which therapies got furthest in those first terrifying months. And because Dr. Buddha was actually connected with him on a personal basis, when their research was published in, I think, The Lancet, I'm not sure which journal, lots of countries cited, but the top two boxes, there was data for COVID therapy in the UK, and the next one was data for COVID therapy in Nepal. And I think those kinds of deep-rooted research relationships are a fantastic way to knit our countries together. I wanted also to name check Mathieu Ricard, the happiest man in the world. He hates that title. But I did go to his talk at Medicity and found that very, very illuminating. There is something very true, and I could see doctors and nurses actually taking notes as he was talking, because he can save them from that kind of empathy with their suffering patients, which hurts the empathizer and leads to the burnout of medical professionals. And he was teaching us how to do a different sort of projection of love towards the sufferer in a way which didn't erode the resources of the empathizer. I thought that was a fantastic evening. Before I finish, I did want to acknowledge the sort of counterintuitive pilot project which the UK has to recruit nurses from Nepal. I'll take that on the chin. When I was appointed here, I did express surprise that was what we were doing. The fact is that besides needing nurses in the UK, Nepali nurses were arriving in the UK in very large numbers. And we did feel, Pratima, that's a very good question, we did feel that they were safer in a government-to-government relationship than they would be just getting a visa and coming themselves and seeing what happened. So we have this pilot project running, but I underline the word pilot. We are going to take a development cooperation approach to this. We want to get the data on what its impact has been here, and if its impact has been net negative, we are going to stop it. This is a small part of the bigger question around migration and brain drain, and how can we make sure that the young people, the kids stay in the country, that there is not just health, but there is education and there are jobs in particular here to keep them here. To end on a very sort of honest note, I don't see a way to connect the program which we are negotiating with the Ministry of Finance, Samartha, directly with this initiative. I think that's on rails, and I think it is in that sort of system strengthening space which we hope will be at scale. But I do think that the British medical sector wants to be connected with Nepal. I will always look out for ways to deepen that connection. And if I had a tip for the top, or some area where I will particularly focus, it is in this area of collaborative research internationally. I think if we can make this initiative connected at as many levels as possible as we can with British institutions and individuals in the same field, those connections will happen. Thank you.
Your Excellency, for your remarks. I think that there will be ways to collaborate in whichever format it will be. We are almost at the end of the program. I would like to request Professor Dr. Rameshkant Adhikari, the board directors of Corona, for vote of thanks. And then the delicious food is waiting somewhere nearby. The beautiful evening is there.
Thank you, Deepakji. It's an honor for me to be here and to address you, all the excellencies and officials and dignitaries. I'm asked to offer vote of thanks, but I'd like to add a few points here. I'm not a student of history, but I remember reading somewhere that the famous historian Arnold Toynbee had said, the human history can be written in 3 words: challenge, response, and further challenges. Why we have reached here? Because we have responded to earlier challenges. We gave our children vaccines, they are surviving with problems. And we are helping our mothers, but now the newborns are surviving, and those who are dying, they are dying of complicated diseases, and the mothers ask for a solution. So today's challenges are responses of the past years. And I think we must feel good that we have been working in the right direction to reach here. So I think if you look at the work of KIOCH, I can see few possibilities here. I'd like to address this question of brain drain, people leaving. Whenever I meet parents of doctors or nurses or professors working in USA, Australia, or UK, they say, what is the place where they can come and work? And they also see some possibility that a reverse travel of professionals back to their home is a possibility through an organization like this. I think the problem with the government system is, I don't blame them. Is a doctor working at a lower level will naturally expect a promotion. A highly trained professional comes from outside, cannot take his or her place. In the government system, that flexibility is not there. But in this system, they can come and join a place where they can offer their services very easily. And so I think here today, when we are discussing about the different areas of cooperation, HR, training, opportunities for further training and coming back and working here is a great possibility. And that's going to change the scenario. And another thing is, we are seeing newer problems in developmental issues. And for that, we'll need a different approach. And for that, KIOCH approach through research and finding new challenges and finding solutions through research is also another possibility that we're trying to work on. And here I'd like to just share why we, the professionals, have joined together. It may look a little bit a daunting task, very difficult, but I think there is a need, and we have faith in that he has proven himself as a good manager, not only as a professional, but also as an organizer and a good manager. That is why the whole team is behind him. And we hope there is a lot of enthusiasm. There are a lot of challenges also. There is a lot of criticisms also by private sector. This is not private sector, this is non-governmental organization. This is not profit making. It is to be prepared for the country, for the people of Nepal. With these hopes, we are on this, it gives us sleepless night. We feel, what are we doing here now? At this age, my age retired. I have retired from military medicine 12 years ago. This is not a time for new initiative, but at least very worthy cause in the hands of a person who has proven himself that he can do it. So with this, we're in the team, and I find this evening very encouraging. All of you are very forthcoming with your ideas and with your suggestions, and your presence itself is a proof that you are in it with us. And with this hope, I am quite enthused and hope that we'll be able to reach the mountaintop, though the journey is going to be very, very difficult. With this, I'd like to thank you all, and particularly Sagitaji, for highlighting the issues or highlighting the ways that you can support us in future. With this, I'd like to stop here, and thank you very much once again.
Thank you, Professor. We are done. Now we have an evening with beautiful food and drink, and the company that we have. Let's be to the informal session.
Have a mic one time.
Yeah, and enjoy the evening. Thank you very much.
I'm so sorry, everybody. You're going to have to bear with me. As we were sitting in the lobby in the front, waiting to receive all of you. One of my ears was listening to some consoles. So apparently we have 63 consoles?
62.
62 consoles, and I think I heard something like if every console would donate a lakh, that would be 63 lakhs, right? So I did hear something like that, so I just want to pick that up, and I'm thinking the Dwarikas will do their part to say, okay, if the consoles, you need to have a space to have a dinner, let's call it a fundraising dinner, you raise a lakh per console or more, Dwarikas will fund the dinner and the evening. So at least the project gets, so this is when the ball's going to be on the court of the consoles to actually get every 62 consoles to be here, and even not there, at least to contribute that 1 lakh. I think I heard that while I was there, so please,
Just
this
use
is
the
addressing
figure.
the consoles.
It can be more, it can be
It would be great if it would be more, but it was just, I think I heard that and I said, let me not lose this opportunity. I might be crossing my line, I might be going out of place, but you know, whatever comes spontaneously, do it. The only answer you could get is no, but let's take a try. You know, it's not for me, it's by the kids. So, yes. So thank you everybody. So we have drinks and cocktails and dinner. So let's have some fellowship and more understanding. Thank you so much.